Finding of fact number 13. Dr. John Peterson, a double board certified physician in oncology and hematology, testified that Dr. Buttar practiced in a manner that departed from and failed to conform with the standards of acceptable and prevailing medical practice in North Carolina for the treatment of cancer for patients A, B, and C. He testified that none of Dr. Buttar's treatments was indicated for the patient's cancers, none was effective, and that Dr. Buttar's treatment of these patients was, in his opinion, fraudulent. So what this man is saying is that my treatment of the ovarian cancer patient that had a CA-125 of over 10,000, which he himself said it's very rare to see a cancer that high, but there's nothing that can be done for somebody that has a CA-125 of over 10,000. The fact that it dropped down to 6,000 in 3 weeks of our treatment documented that was totally fraudulent. According to this man, to drop a cancer marker that he follows himself, when he couldn't drop it down, and other doctors couldn't drop it down, but using our treatment philosophy, we were able to drop it down by 4,000 points in 3 weeks, that's considered fraudulent. Or that you take a patient that was obtunded to the point that she had to be brought in a wheelchair, and we were able to actually help her start to walk within a week of our treatment, and her abdominal pain and distension and her nausea was actually improved, and she felt better, and her white blood cell counts actually started coming back into the normal realm, that treatment that we did for that patient is fraudulent. And this adrenal cancer patient that was given a very short lifespan and told that there was nothing else that could be done for him, that the fact that he was able to actually travel to another country and actually get some time and respite and be able to do things that he wasn't able to do. For instance, the fact that he was essentially sleeping more than half the day in the bed, but after he started our treatments was able to go to his kids' baseball games and enjoy playing the guitar again, and start working on putting a website together to show the world what he was going through and how much better he felt now compared to what he had felt before, that this was all fraudulent. This doctor, Dr. Peterson, was there and saw all that stuff, and of course we know he wasn't there, but he was able to read the medical charts, and even despite reading the charts, which he apparently did in 2 hours, reviewing over 1,000 pages, that he still did not see that evidence. I would question if this Dr. Peterson has even a rudimentary understanding of the English language. And this is not just my opinion. You could say, yeah, I'm hot right now and I'm angry right now because of this statements that this man has made. But I'll tell you what, I want you to look down and see the testimony, see the written response from the 9 expert witnesses that we had regarding this man's testimony. I had 2 different doctors ask me a question. They said, how much money do you think the North Carolina Medical Board paid this witness to have him lie? Because that's the only thing that's possible. Either he lied or he simply didn't review the chart, because everything that he says is in direct conflict with what the medical charts that he reviewed. But don't take my word for it. Read the charts yourself. They're all available in PDF format, all 1,000 pages for you, anybody to look. Of course, the names of the patients have been taken off, but they're labeled as patient A, B, C, and D in order to make sure that we're in full HIPAA compliance, so there's no personal information that's being given out.